Good morning. I will talk about the medical and the health economic perspectives of telemedicine in Austria. My name is Doz.Pabinger. I receive some funds from governments and scientific organizations, very few from the industry. I've been in quality control and outcome measurement since 25 years. I run a private, very small hospital doing sports surgery, stem cell therapy, and I'm in telemedicine since nearly 10 years, where I have a lecture at the Medical University of Innsbruck, and I'm president of the Telemed Austria, which is a scientific cooperation dealing about telemedicine in Austria. As PayPal is the biggest bank but has no bank offices, and as Uber, the biggest taxi company without taxis, and Facebook, the biggest publisher but has no writers, I will show you that in the future some health maintenance organizations will be big and important but have no hospitals. As you can see, in telemedicine everything is possible that's possible from a technical perspective. Every time there is a new invention like the 3G net or the LTE, the publications go up, even with the SARS-CoV pandemic. It is a billion-dollar market growing steadily over the last years and even growing faster in the future, as I will show you now. The bubbles represent the numbers in $1 billion and are drawn to scale. So on the left-hand side you see the GDP of the world, of the US and Germany. Then you can see the healthcare expenditures between 10 and 17% of the GDP, and the telemedical expenditures vary along. And the bubbles will grow over the next years. They will become bigger, and I show you how. The biggest increase will be in absolute numbers in the US, then Germany, and then the rest of the world. But the compound annual growth rate is very different from country to country, as you can see in the next slide. Here again you have an overview about the situation this year and the situation how it will look like in the next 5 years, and this is a rather conservative assumption, and the expenditures will grow by $123 billion, will be as double than now, and the biggest increase will be in the rest of the world and not in the US or in Germany. This is when you look here now, the biggest investments have been already done in the US, and countries like Germany are way back, and this is in the green sector, the biggest part, and India is also strong, and China and Canada, and this is where the growth will come from. But the growth is not continuously, it's rather erratic, and from country to country and from month to month it differs a lot, and this makes the future forecast a little bit difficult. Talking about numbers, here's a McKinsey study saying that there could be a benefit of 1% from digital health realized right now. What do they mean? They segmented the whole medical market into 7 special targets. I show the 6 most important ones here, and for instance, if you invest a little money in paperless data, in digitalization, this costs an extra sum of money, but the sum that you get back as cost cutting is much higher, and therefore if you add the money that you invest in the cost cutting, then you have a certain number of money, and this is what the calculation is, but it's not additional revenue, it's also some savings in these figures. And all this paperless data and the online interactions, the automation account for more than half of the savings. And the patient self-service is only a very small sum in terms of money. But it's interesting from the marketing perspective because it's the step in the door where you can directly approach the patient. And the nice thing in this study is that 70% of the savings go directly to the health maintenance organizations. This is the doctors, the hospitals, and the nurses, and the physiotherapists, and so on. So they have more time for their patients because their business is run smarter, and 30% only of the savings go to the insurances, so the payers. And this is a very nice message. A Roland Berger study also made a prediction over the next 5 years, and they said there will be more cooperation and more competition, focusing on the following. Client relationship management or patient relationship management will be a big focus. Saving of time will be one finding. Inpatients will become outpatients, and outpatients with digitalization, this is then called blended care. And there will also be an increase in managed care of certain diagnoses, and this will change the process, how things are being done in medicine. And why is that like this? It's very easy, because the number of data increases exponentially, and as soon as we have more data, we can sort out our way how we do things, and we can implement managed care processes. But who owns these data? If you ask 400 healthcare experts, 40% in Germany, 40% in the European community, and 20% outside the EU, 40% of those people think that governments should be the keeper of the data, and 1/3 of the people think that established health insurers should keep the data, and less than a third think that private enterprises should own the data, like pharmaceutical companies, healthcare startups. What will the keeper of the data do? They will steer, they will implement provisioning and influencing processes. That means that the customers, the patients, are steered towards a network of preferred partners, maybe their own hospitals. There will be a provisioning, and you will get a reduction of your annual fee if you go to certain health maintenance organizations. And they will also influence the people, like make incentives to stop smoking, to walk more, to do more sports, and so on, to eat healthy food. I show you how a modern patient journey in heart insufficiency will look like in the future, and how this is already done at the Medical University of Innsbruck. It starts with the myocardial damage. The daily life pattern changes, and you gain weight because the water is kept in the body and cannot be pumped through the body by the heart, and it's kept in the lung, and therefore you have a cough. And then it's too late, because that's really a severe disease, and in most cases you go to the ICU and you stay there very, very long, and a lot of people die. So this is a bad thing to have. And there was an invention, and it starts with a weight in the morning, and the weight asks you, how did you sleep? Did you use an extra pillow, and did you cough? Because what happens when the water in the lung increases, then you start coughing. You need an extra pillow to give your upper trunk, to lift it, to elevate it, and you don't sleep good. And with a digital connection to the clinic, a decision support system decides if you just have to take another medication to get away the water via the renal pathway, or if you have to go to a doctor, or if a nurse talks to you. So that's all automated. And this was implemented 15 years ago. It's called Herzmobil-Tirol, and it causes a reduction of death overall of half. In the first year, the mortality goes down by 60%, the hospitalization goes down, and this, what happens is that the doctors have more time for the patients in the clinic. This is why it was invented. The patients feel safe. There were a lot of interviews done in scientific studies. It's published some weeks ago in a very good journal. And people really feel safe because they are directly connected, and the only thing they have to do is stay on the weight in the morning, and then make a measurement of their blood pressure. And if they want, they can also make an ECG at home, but they are connected to the clinic if they want, and they feel safe, and they live longer with a better quality of life. It's also implemented in other countries now. It took 15 years to start. It was EU financed, and a big thing. The next patient journey I want to show is depression. It was invented in Netherlands, how to cope with that. It starts with a serotonin problem in the brain. The social interactions go down. You have rather unspecific symptoms like fatigue. Most people wait or have to wait because they get no place for therapy, or they go to GPs or to specialists, and so on and so on. And it takes long until the therapy starts. And that's also not the desired pathway. So it works like that. If you have these problems with unspecific symptoms and so on, the doctors are forced to bring you into an online therapy program to improve their way back to work. The program is called therapyland.nl, and it has a very strong reduction of days back to work, 42 days instead of 170. Cost is going down, the waiting time is going down, and there are more than 150,000 patients treated yet. So it's 100% reimbursed, and the doctors know it, and you can decide as a patient if you want a female or a male therapist, if it's a real therapist or just an animated therapist, or if you don't want to see anything, you just want to write, or you want to do the program with auditive alone and no visual components. So it's really flexible and can be adapted to the specific patients. It also took 15 years. It was started by a private company, and it's now socially reimbursed by the social insurance. But it's only in the Netherlands. We have more than 300 apps for depression right now. And a recent review in the last weeks published analyzed 100 of them with a very strong criteria catalog, and found out that only 30% have a suicide risk management option, and that 80% of those apps share data with third parties, and that's not desired. So what we need is a certificate to explain the users what is a good app and what is not a good app. So if the future is blended care, where more is done in the internet, who will be the drivers? I made a small forecast. So I think that private drivers will change the system. If you compare hospitals and insurers and startups, so the pressure on the private companies is even bigger than to the public companies, as always. But on the other hand, the innovative potential of the private hospitals and insurers and even the startups is higher than in the public hospitals or insurers. Same with the skills. They have the power to attract people with these skills in telemedicine because they can pay what they think that's reasonable, and they're more flexible on these things like fringe benefits and so on. And they also have the power to bring the force down to the ground, and therefore I think the innovation will come from startups, from private insurers, and from private hospitals, and this is more or less what's seen in literature. I give you an example of a state insurance without the awareness of telemedicine in Austria. I'm self-employed, and I had an operation of the knee in July, and I had to fill out all those pages, and there's no contact information. It's no street, no telephone number, no address, no email, no secure pathway to give them digital information, although everything is digital now. And when I call the hotline, it's not answered in 90%. And when someone answered, he's incompetent and doesn't know what I'm speaking about. And I had to invest several hours just to get 1,000 euros back from my insurance because I was not working for 3 months. So this is insane. And when I compare this with my more than 10,000 patients and patient contacts in the last years, the COVID even slowed all these processes down. The next example is we could have telemedicine in some doctors, maybe in 16%, but it's not still working really. So we have 40,000 doctors, 1/3 are GPs, the others are specialists. We do not have a system for video call, e-referral or e-testing, but we have some kind of e-recipe and e-vaccination, electronic health record, which is difficult to access. Because as a doctor, you need mechanical things like the O-card system, the E-card system, the Gina box, a proprietary slow internet connection, a monopoly contract to a state company, and it costs really a lot of money. And you have to have an own tablet with a special software where nothing else is allowed to run on it. You have to register, and my secretary skipped that after some days because it was impossible for us to get it, and it would take months to implement it, and it costs 10,000s of euros. So what we, like all doctors, use is fax. So there is basically no connection between the clinic and the specialists or the doctors outside the clinic, although we have a system called DAME or Medical Net, which is working fine, and I have it also. It is basically a secured internet connection between different providers of healthcare. and only few doctors use this system, and the state more or less does not use it, although it's really nice working. So we use fax. And this is why Austria is in the lower half of the Digital Health Index. How trustworthy are we? How did it change? So last year, a third of the people had no trust in the government, and this year 72%. And this is not my data, this is state data. This is from the University of Vienna, the Austrian Corona Panel project, and you can read it. And what happened is there was a loss of trust against the state and the stakeholders of medical things. So this happens when institutions do not adopt. We saw this in several countries before. I'm going to summarize what I've been talking up to now because I'm coming to the end. So telemedicine, first of all, is a function of technology. It has a strong compound annual growth rate of 14 to 40%. And there are more than 50,000 publications about telemedicine which are really worth reading or implementing, and the solutions are already there. Because they are not implemented, we are in the lower half of the Digital Health Index right now, and we lose trust from our patients. And as I will show you now, there's few awareness for data and security and legal issues in most of the companies dealing with medicine. So the organizations will face organizational and IT issues in this future. This is what we saw as Telemed Austria in the last years. A lot of companies asked how should we communicate in the lockdown, because they wanted to open the hospital or the practice or the company for patients, but not for enemies, of course. And they asked themselves, how safe are my data? Are they secure? And what's possible from a telemedicine point of perspective? And a lot is possible technically, but what's allowed? With who do I need a contract? It leads to a change of conduct in the respective companies. It leads to a change of how they are handling their data. And three issues pop up, like data security, legal security, and risk management. And what happens if you change your conduct? You have to change your whole organization. And to support this, we were at the Ministry of Health 5 years ago, and we put the word telemedicine in the general social security law some years ago, and it's now, from a legal point of view, allowed to do telerehabilitation or some kind of telemedicine in Austria. We have three different solutions for our clients. First, we make a certification of companies. We make a certification of small and medium enterprises like physiotherapists, doctors, nurses, and so on. And we offer e-learning. The first products are for bigger companies, and the e-learning is for every individual interested in telemedicine. So how does this e-learning and this certification process work? The certification is that we make a registration according to the medical chamber, and we make a review of how you are handling your data and how you're doing your medical business, but only from the technical perspective. We are not allowed, and we are not willing to check if your medical competencies are good or not. We do this in cooperation with the Quality Austria, which is the biggest certification company in Austria, and you see also the price for the companies. How does it really work? It is a self-declaration in the beginning, then an interview, and then we give some advice. Usually 1 month later we make a second interview because some things have to be changed, some processes may be adapted, some paperwork done, and then we hand over the certificate, and you can use it and signal that you are doing things properly and on a legal basis. Interaction between patient and health maintenance organization is one focus. The next focus is quality. The next is data security and the error culture. What people say who have done this certification is the following. They feel secure, they feel approved, they save time, they can reach out to their patients digitally easier, and they save time for their own spare time, and they like it. So we found 10 key benefits for the certification, and let me point out the most important ones. An electronic health record saves time, it increases the quality of care, it increases also the data security, and it leads to a reduction of bureaucracy and of legal risks that you face. So how will be the future after this corona time? Telemedicine has come to stay. The Telemed Austria offers some help, like certification and e-learning from our webpage, telemedicine.at. The globalization already slowed down a little bit, and also the supply chain was ruptured in some specific parts. I think about China and Asia. The digitalization is accelerated, the supply chain is re-evaluated in the whole world, and the value added shifts to the first world countries. And there will be a demographic change that the GDP slows down a little bit in the top OECD countries, and there will be a shortage of skills in the future due to epidemiologic problems. And this leads to the problem that the risk management gains importance. And this is where we can help as Telemed Austria. We can help you with certification when asking the right questions and offering some e-learning to you. So thanks for listening.